Today we're assessing the musculoskeletal system and the neurological system. Um, First, when the patient walks in, you're going to assess the posture, gait, distribution of the weight, position of their feet, and balance. First thing to do is to inspect the skeleton and the extremities and compare the sides for alignment, contour, and symmetry of body parts, size, and any gross deformities. So look from head to toe, looking at all the extremities. Okay. Inspect the skin and the subcutaneous tissues over the muscles and joints for color, number of skin folds, swelling, or masses. Skin folds should be symmetrical on each side. And then inspect the muscles and compare the sides for size, symmetry, fasciculations, or spasms. Next, you'll palpate all the bones, joints, and surrounding muscles for muscle tone, heat, tenderness, swelling, and crepitus. Okay. Test each major joint for active and passive range of motion and compare the sides. Passive range of motion should have 5 more degrees than active range of motion using a goniometer. Test the major muscle groups for strength and compare the sides, and rate the strength on a scale of 0 to 5. So first, the hands and wrists. You will inspect the dorsum and palms of the hands. Okay. Inspect for contour, position, shape, and number and completeness of the digits. Palpate each joint in the hand and the wrist. And then test range of motion. The metacarpophalangeal flexion and should be 90 degrees and hyperextension should be 30 degrees. So flexion, hyperextension. I'm going to do that on your own. Okay. Thumb opposition. So can you put your thumb to your pinky? Okay. And can you form a fist? Okay. Can you do wrist extension, hyperextension, and flexion? So all the way out and up. Radial and ulnar motion. Go. And then finger adduction and abduction. Spread your fingers and put them together. Okay. Then to test the muscle strength with wrist extension, hyperextension, and the hand grip. Put your hands up against my resistance. Put them down against resistance. And squeeze. Okay. Next, the elbows. Inspect them flexed and extended for contour and carrying angle. So the patient will be standing and put your arms down to your side. They should come down at 5 to 15 degrees. Palpate the extensor surface of the ulna, olecranon process, and the medial and lateral epicondyles of the humerus. So put your arm at a 90-degree angle. Okay. Test for range of motion. Flexion should be 160 degrees, extension 180 degrees, pronation and supination 90 degrees. So flexion and extension, supination, extension. Next is the shoulders. Inspect the shoulders and shoulder girdle for contour. And palpate the joint spaces and bones of the shoulders. So, kind of get your back towards the camera. Okay. So, contour and palpate. Okay. Testing range of motion. All right, face the camera. Okay. Kind of sit up and shrug the shoulders and forward flexion. Raise your arms forward and straight up. Okay? And then behind your back. Okay. Abduction and adduction. So putting your arms in front of your body and behind. And that's if you're standing. And then internal and external rotation. So can you put your hand behind your hips and your elbow out on each side? One each. And behind your head with your elbows out. So one each. Oh my gosh. Then to test for the muscle strength, also testing cranial nerve 11, I'll have him shrug his shoulders, do abduction and forward flexion, medial rotation, and lateral rotation against resistance. So, shrug your shoulders. Okay. Do forward rotation. Put your arm out, out, and then push it down. Next is the temporomandibular joint. I'll get closer for this one. It's going to be your face. Is that close? Okay. Palpate the joint space for any clicking, popping, or pain. All right, open your mouth. Close. Open. Close. Okay. Test the range of motion. Open and close your mouth. Okay. They should be able to open their mouth 3 to 6 centimeters. And can you move your jaw laterally, side to side? To be able to move their jaw 1 to 2 centimeters each. And then can you protrude and retract your chin? Okay. Then to test the strength of the temporalis muscles by having the patient clench their teeth. Clench your teeth. Okay. And that tests cranial nerve 5. Next is the cervical spine. Inspect the neck for alignment and symmetry of folds. Test range of motion with forward flexion, hyperextension, lateral bending, and rotation. Okay. Can you move, put your head forward, and then back, and then to the side, and the other side, and rotate. And then to repeat that, test the strength of the sternocleidomastoid muscle and trapezius muscles, which test cranial nerve 11, the spinal accessory muscles. So you're going to repeat that with opposing force. So, okay, put your hand forward. Okay, back, side, side, and then turn, and turn. All right, next is the thoracic and lumbar spine. Turn your back towards the camera. Okay. I'm going to go to inspect the spine for the alignment. And note kyphosis, lordosis, or gibbous. Palpate the spinal processes and the paravertebral muscles. So have the patient stand up and touch their toes, and then feel. Okay. Percuss for any spinal tenderness. Okay. And then test range of motion with forward flexion, hyperextension, lateral bending, and rotation. So kind of, I don't know, bend forward to touch your toes. Okay, bend backwards. And then bend to side, inside, and rotating. And the patient will be standing. Next is the hips. Might have to stand on this one. Stand up. Face that way. Okay. Inspect for symmetry and level of the gluteal folds. Palpate the hips and the pelvis for any instability, tenderness, and crepitus. I'll do that with him laying down. And then test for range of motion. Okay, actually, you can lay down.
Okay.
Yeah, lay down.
Back or so?
Back. Okay. Palpate the hips and pelvis for instability, tenderness, and crepitus. Test range of motion. First flexion should be 190 degrees. So bend your knees to your chest, one at a time. Okay. Extension. Okay, with your knees straight, lift your leg up. Hyperextension would be behind his back when he's standing or lying prone. Adduction and abduction. Adduction would be away from the midline, and adduction would be towards the midline. Should be 30 degrees each. And then internal rotation with the knee bent should go to 40 degrees either way. And then external rotation, he's going to pull his ankle up to his knee. And test muscle strength with the knee inflection and extension, abduction, and adduction with resistance. Okay. The legs and knees. Inspect the knees for the natural concavities. Palpate the popliteal space and the joint space. Okay. Palpate the tibiofemoral joint space, the patella, the suprapatellar pouch, and the infrapatellar fat pad. Okay. Test range of motion with flexion while they're standing and extension. Flexion should be 130 degrees and extension 0 to 15. And then test the strength of the muscles by doing that with resistance. Next is the feet and ankles. Inspect with weight bearing and non-weight bearing for contour alignment with the tibias, size, and the number of toes. Alignment. And palpate the Achilles tendon in each metatarsal joint. And test the range of motion. Dorsiflexion should be 20 degrees. Plantar flexion 45 degrees. Inversion 30 degrees and eversion 20 degrees. And then flexion and extension of the toes. pull your foot up and then point it down. And then like put your foot in, like rotate it in and then out. And then your toes. Okay. Test the strength of the muscles in the plantar flexion and dorsiflexion. So by doing that against resistance. All right. Procedures with the hand and wrist assessment. You'll do the cat's hand diagram. These all test for median nerve integrity. The thumb abduction test. So put your thumb up and push down against my hand. And then push up. And then the Tinel sign. So, is there any tingling? Okay. And then the Phelan test. Put your hands like this. And we'll hold it for 1 minute. And it'll tell me if there's any pain. And those will all tell you signs of carpal tunnel syndrome. Done. Next would be the shoulder assessment. The NEAR test will tell you, the NEAR and the Hawkins test will tell you shoulder rotator, if there's shoulder rotator cuff impingement or tears. The NEAR test, you're going to flex your arm forward 150 degrees while pressing on the scapula. So I'm going to press on that, and you're going to take your arm and put it all the way up. And then tell me if there's any pain. And then the Hawkins test. So abduct 90 degrees, elbow out 90 degrees, and then internally rotate. Okay. Then the lower spine assessment. The lower spine assessment, you do the straight leg raising test and the femoral stretch test. The straight leg raising tests tell you L4, L5, and S1 nerve root irritation. And the femoral stretch test will tell you L1 to L4 nerve root irritation. For the straight leg raising test, you're going to lie supine, slightly raise your neck, and then raise your leg with the knee extended. So see if there's any pain, and then turn over on your stomach. The femoral stretch test, you'll lift your leg straight up. Okay, now go back on your back. With the hip assessment, you do the Thomas test and Trendelenburg test. The Thomas test tells you if there's a flexion contracture of the hip, and the Trendelenburg test tells you if there's weak hip abductor muscles. The Thomas test, he's going to lay supine. You're going to do one leg, bring your knee to your chest, and we'll keep this leg flat. Okay. And do it on the other side. Okay. And then the Trendelenburg test, you will have, he will stand up on 1 foot at a time, and you will look for iliac asymmetry. Okay. Knee assessment, you do the Ballottement test, bulge sign, McMurray's test, anterior posterior drawer test, and Lockman test, and the varus and vulgus stress test. So the Ballottement test tells you if there's an effusion in the knee. I'll put downward pressure on the suprapatellar pouch with one hand. Use the other hand to do a sharp push against the femur, and listen for any taps or clicks, and then release and watch for the patella to float back down. With the bulge sign, you will milk the medial and lateral side 2 to 3 times of the patella and observe for bulge of returning fluid. Do it with your pants on. The McMurray's test will tell you if there's a torn meniscus in the knee. He will lie in supine and flex the knee, and then put valgus and varus stress on the leg. So flex the knee, and then okay. The anterior and posterior drawer test. He's going to lie supine, put your foot flat against the table, right there, and okay, I'm going to push the tibia in towards the femur and see if there's any movement. Okay, there shouldn't be more than 5 millimeters of movement. And that tells you the anterior and posterior cruciate ligament integrity. Then the Lockman test tells you anterior cruciate ligament integrity. So with the knee flexed 10 to 15, or 0 to 15 degrees and the foot flat on the table, push the tibia forward. That's what I just did. Okay, the other one was forward and back. The varus and valgus stress test. Test the medial and lateral collateral ligament instability in the knee. So knee extended and then 30 degrees each way. So 30 degrees. And then you can do limb measurement, and if you suspect anything to be asymmetrical, and there should be less than 1 centimeter of difference in limb measurements, lengthwise and circumferential. Abnormalities in the musculoskeletal system are ankylosing spondylitis, lumbosacral radiculopathy, lumbar stenosis, carpal tunnel syndrome, gout, Lyme disease, temporomandibular joint syndrome, osteomyelitis, bursitis, Paget's disease, fibromyalgia, osteoarthritis, and rheumatoid arthritis. Sports injuries include muscle strains, dislocations, fractures, and tendonitis. Also rotator cuff tears. Infants and children, you may see clubfoot, metatarsus adductus, leg calf Perth's disease, Osgood-Schlatter disease, slipped capital femoral epiphysis, muscular dystrophy, scoliosis and radial head subluxation, and older adults may show osteoporosis and Dupuytren's contractures. Now we're going to assess the neurologic system. First, we're going to assess the level of consciousness and go back to the mental status questionnaire. Then we're going to test the cranial nerves 1 through 12. Okay, for the olfactory nerve, cranial nerve 1, you're going to test the ability to smell 2 to 3 aromas, 1 nair at a time. So you're going to close your eyes and close one nostril. Close the nostril. And do the other one. And you'll do 2 to 3 of those. You can use peppermint and other aromas. The second nerve is the optic nerve. You will test the vision with the Snellen and the Rosenbaum chart, which we have done in a previous video. And then you will do the ophthalmoscopic examination of the fundi. Next, we're going to test the third, fourth, and sixth cranial nerves, which are the oculomotor, the trochlear, and the abducens. These are the extraocular movements, which the abducens does the side gaze, trochlear does the medial oblique downward, and the oculomotor does all the others. First, you'll test the 6 cardinal points of gaze. So, look at this and follow it with your eyes. Okay. Then test the pupil size, shape, in response to light and accommodation in the opening of the upper eyelids. Next, evaluate the movement of the eyes for presence or absence of the lateral gaze. And the sixth cranial nerve is commonly the first to lose function with increased intracranial pressure. Next, we'll test the fifth cranial nerve, which is the trigeminal nerve. The sensory functions are the forehead, cheek, and chin sensation, and the motor functions are jaw clenching and movement. So I'm going to have you clench your teeth while I palpate the muscles over your jaw. So, clench your teeth. Clench. Okay. Evaluate the tone and whether it's symmetrical and without fasciculations. Then the three divisions of the face are the scalp, cheek, and chin. And I'm going to alternate sharp and smooth sensations. So close your eyes and tell me if you feel sharp or dull.
Sharp. Dull.
Eyes closed.
You're poking me. Sharp. Dull. Sharp. Dull.
Okay. Then stroke a cotton wisp on all 6 areas, and they will tell you if they feel it or not. So close your eyes. Close your eyes.
Yeah. 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 Yeah.
Okay. If that's impaired, then you'll do that with heat and cold. Next is the corneal reflex test. With their eyes open, avoiding the eyelashes, you will take a cotton wisp to their cornea and they should blink. And I was told not to do that anymore. Next, test the 7th nerve, the facial nerve. Its sensory functions are the anterior 2/3 of the tongue for taste, and the motor functions are the expressions. So I'm going to have you puff your cheeks out. Smile. Raise your eyebrows. Squint. Squeeze your eyes shut. Wrinkle your forehead. Frown. Show your teeth. And purse your lips like you're whistling. Observe for tics and unusual facial movements and asymmetry of expression. Okay. Listen to the patient speak and note difficulties enunciating the labial sounds, which are B, M, and P. And notice if there's muscle weakness of mouth drooping or flattened nasolabial folds and lower eyelid sagging. Then evaluate taste. So the 7th cranial nerve is the anterior 2/3 of the tongue, and the 9th cranial nerve is the posterior 2/3 of the tongue, 1/3 of the tongue. So you'll take 4 taste solutions: bitter, sour, salty, and sweet, and one at a time touch to each side of the tongue in the appropriate taste bud region. So stick your tongue out. Okay. Tell me if you taste bitter.
Yeah.
And bitter, sour, salty, and sweet. And then bitter, sour, salty, and sweet. Okay. Next is the 8th cranial nerve, which is the vestibulocochlear, or the auditory nerve, which is hearing. And with chapter 12, we did this hearing screening test, the response to questions, the whispered voice, Weber and Rennie test, and then the Romberg test, test balance. So you'll have him stand up and close his eyes, and there should be minimal swaying. And loss of balance would be a positive Romberg's test. Next is the 9th cranial nerve, the glossopharyngeal. The sensory is the posterior third of the tongue, and the motor is the gag reflex. So that's also tested with the 10th cranial nerve, the vagus nerve, which is gag and swallow. So you will elicit the gag reflex and observe for upward movement of the palate and contraction of the pharyngeal muscles. So I'm going to gag you. Open. You didn't really gag. Okay.
I gagged.
All right.
Hilarious.
Then observe movement of the soft palate and uvula for symmetry as the patient says ah. Open. And then have the patient sip and swallow water. This can also be done with the thyroid examination. Okay. They should be able to swallow easily with no retrograde passage of water through the nose. Also listen to the speech and note any hoarseness, nasal quality, or difficult with guttural sounds. Next is the 11th nerve, the accessory nerve, which involves neck movements, shoulder shrug, arms in the vertical position. So evaluation of size, shape, and strength of the trapezius and sternocleidomastoid muscles, which is done in the musculoskeletal examination. Next is the 12th cranial nerve, the hypoglossal nerve, responsible for tongue movement, strength, and tremors. Or watching for tongue movement, strength, and tremors. Okay, so stick your tongue in and out. And stick it out and move it side to side. Try to touch your nose. And try to touch your chin. Note strength against cheek resistance. So put your tongue in your cheek. And listen for any speech problems with lingual sounds, L, T, D, and N. And note any fasciculations, asymmetry, atrophy, or a deviation from the midline. Okay. Next is testing cerebellar function and proprioception. So evaluate coordination and fine motor skills with rapid rhythmic alternating movements. So pat your hands. More than once. Okay. Put your thumb to your fingers. Okay. And run your toe up your shin. And down. And accuracy of upper and lower extremity movements. So put your finger to your nose and then to my finger. And then close your eyes and then alternate from out to your nose. Okay. And then, all right, evaluate the balance using the Romberg test and observe the patient's gait for posture, rhythm, and sequence of stride and arm movement. Have them do a heel-to-toe walk, hop on one foot, and stand on one foot at a time for 5 seconds with your eyes closed. Next is sensory function. Close your eyes and keep them closed. Test primary response to superficial touch with a cotton wisp at different points on the body, and they will point when they are touched. So when you're touched, just point to it. And superficial pain would be the sharp and dull at different points.
Sharp.
Yeah. And test vibratory response with a tuning fork over joints or bony prominences on the upper and lower extremities, starting distal and going proximal. So we're going to do this on upper and lower. And here's my tuning fork. Let's strike it. And tell me when you feel vibration. Your eyes are closed.
No. 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 No.
Okay, next is evaluating perception of position sense with movement of the great toes or finger on each hand. So close your eyes. Now tell me if I move your finger up or down.
Up. Down.
And also with the toes. Next is stereognosis. You're going to assess the ability to identify a familiar object by touch and manipulation. Right, close your eyes. And tell me what this is.
Keys.
Okay. Next is 2-point discrimination. And you're going to tell me whether I'm touching you with one or two, close your eyes, 1 or 2 points.
One. 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 What?
Was that 1 point?
I felt like one.
Okay. Close your eyes.
One. One. Maybe you should spread them out.
Close your eyes.
One. Two. Two. One. One.
Okay. Then do the extinction phenomenon and find the point at which 2 stimulus feels like 1. And it should be 2 to 75 millimeters. All right, close your eyes and tell me when it's 1 point touching you.
One.
Next is graphesthesia. You're assessing the ability to identify a letter or number drawn in the palm of the hand. So, close your eyes.
8.
And
Oh, wait. 3.
okay. And then point location, assess the ability to ID the body area when it's touched. So close your eyes and tell me where I touch you.
Knee. Knee. Wrist. Shoulder. Elbow.
Okay. Next are the superficial and deep tendon reflexes. First, test the abdominal reflexes. So, well, they'll be laying down and stroke each quadrant and watch for the umbilicus to move up or down. So, pretend like you're just- Then on a male's, test the cremasteric reflex, stroking the inner thigh proximal to distal, and watch for the testicles and scrotum to rise. Next is the plantar reflex. So I need your foot. Okay. So okay.
What's supposed to happen?
Stroke the lateral side of the foot from the heel to the ball and then going across under the toes. And watch for plantar flexion of all the toes. If they have Babinski reflex, that's normal under 2 years old. And over 2 years old, it can be a sign of pyramidal tract disease. Then test the deep tendon reflexes in the biceps, brachioradialis, triceps, patellar, and Achilles, and on a scale of 0 to 4, and 2 is normal. So the biceps, okay, I'm going to do like that. Okay, slightly better, 45 degrees. Okay. The brachioradialis, strike 1 to 2 inches above this. Okay, you're going to have your hand slightly that way. The triceps, so that. And the patellar, so and the Achilles, which I'm gonna do like this. Okay. And test for ankle clonus, especially if the reflexes are hyperactive. So support the knee with one hand, and I'm gonna relax. Okay. Tactile agnosia is the inability to recognize objects by touch and suggests a parietal lobe lesion. And then with the reflexes, the superficial reflexes, the upper abdomen tests T8, 9, and 10. The lower abdomen tests 10, 11, and 12. Cremasteric tests T12, L1, and L2. And the plantar tests L5, S1, and S2. With deep tendon reflexes, the biceps tests C5 and 6. Brachioradial tests C5 and 6. Triceps tests C6, 7, and 8. Patellar is L2, 3, and 4. And Achilles is S1 and 2. All right, additional procedures are protective sensation, using the 5.07 monofilament or the Wartenberg wheel to test for protective sensation on several sites of the foot in all patients with diabetes mellitus and peripheral neuropathy. Okay, get your foot up here somewhere. So, on the foot, you'll take the monofilament and put pressure until it bends and hold for 1 to 2 or 1.5 seconds, and do that here, 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 and here, and here. Okay, then meningeal signs for nuchal rigidity. Have the patient lying supine. Put your hand under their head and raise it, flexing the neck until trying to get their chin to touch the chest. And they will tell you if there's any pain or resistance. While you're doing that, you will look for Brudzinski's sign, which is the involuntary flexion of the hips and knees while doing that. And the Kernig sign, flexing the knee and hip and then straighten it. Ask if there's lower back pain or resistance to straightening. Okay. Abnormalities of the CNS include multiple sclerosis, seizure disorder, encephalitis, meningitis, intracranial tumor, and stroke. Abnormalities of the PNS are myasthenia gravis, Guillain-Barré syndrome, trigeminal neuralgia, Bell's palsy, and peripheral neuropathy. Children are cerebral palsy, myelomeningocele, shaken baby syndrome. Pregnant woman is intrapartum maternal lumbosacral plexopathy. In older adults are Parkinson's disease, normal pressure hydrocephalus, and post-polio syndrome.